Morning, everybody. We're going to get started here in just a minute. Okay. Okay, let me just make sure. 1, 2, 3. Everyone off muted. Give me a thumbs down if anyone has any issues. Okay, all right. Thumbs up if you're good. And just checking our social media, we're okay? Okay. All right, well, good morning, everybody. This is another installment of our daily briefing with respect to the coronavirus. Today, we are going to focus a little bit on what's happening at our community centers. And as usual, we're going to go through our standard format of updates from our Emergency Operations Center. Those are Central New Mexico wide. Then we're going to talk about the updates from city services. Then we're going to focus on a couple of our experts here with respect to our community centers and what's happening there. Then we'll do our myth of the day and our takeout of the day. And we'll be here for your questions. First thing is, I do want to mention that our office is going to be doing a direct. A lot of people have been saying, when can we speak directly with the mayor and with staff, not just through the media? We're working on how to do this. So starting today and let me check, is it 12:30? At 12:30, we're going to be in a Facebook forum. And it's also going to be on YouTube. And what we're going to do, we know not everyone has the same social media platform, so we're going to do a teletown hall in a couple of days. So basically every few days we'll try and have an opportunity for a public Q&A and conversation as best that we can. Just bear with us as we figure out different technologies. And again, we're going to rotate platforms. So we are starting with Facebook today at 12:30. And next I know we're going to try and do a telephone town hall, and then we'll just take it from there. Okay, so a couple of things. First, I want to thank, of course, everyone in the public and also folks who are working in public safety and healthcare. And I want to take a moment to also thank our childcare workers. We're going to go into why this is so important right now, but right now our childcare workers are what we want to highlight in terms of some unsung heroes who are helping support everyone else that I just mentioned. And we're going to talk about the city's efforts to help support that effort as well. Now, also, I want to mention that for us, the situation continues to evolve, so I just want to emphasize that everything that I'm going to share should be up to date and make sense with respect to right now. That could all change in just a couple of hours or just a couple of days. So, by way of updates from our Emergency Services Center, number one, the Balloon Fiesta Park drive-through testing site. It looks like we are cleared to start Monday, March 23rd from 9 a.m. to 7 p.m. So this is very good news for our city and our state. Again, every new testing center we have is very helpful, but this one in particular, at least, is in a location and in a facility that can better accommodate the traffic and have less impact on roads and also in surrounding neighborhoods, and hopefully also be more effective with respect to throughput. And so, again, bear with everyone. It's the first time we've done this, but we are very optimistic about this new facility. I also want to mention that stand by on details for that. Again, I mentioned the time, but I want to emphasize that all the testing sites, this one is through Presbyterian, so check with Presbyterian in terms of the criteria. Remember, we don't want people to just go get a test because you want peace of mind. We want to make sure that you're going to get a test because you are showing symptoms, especially fever. That's probably the key one. Or you think you've been exposed to someone who has been diagnosed. So again, that's what these testing centers are for. It is not just for peace of mind or because you're not working and you want to know what's going on. Save this for the folks who are showing symptoms who need it. Okay, at our airport, we did have a flight that was diverted, an American Airlines flight that was from LA to Dallas, and it was diverted and landed in Albuquerque. You might recall this actually is a quite common thing, especially for our airport because we have such a big runway and extra gates. To our knowledge, this was not COVID related at all. There was an individual who was deplaned and taken to one of our hospitals, but again, they were not showing symptoms for COVID. I've been on planes where this happens, so we believe with respect to what's happening, that was actually a routine occurrence. Now, I also want to remind folks again on another separate issue, our water authority, which of course is joint operated by the city and the county. Our water authority really wants to encourage folks about what you are flushing down the toilet. So as a reminder, it's got to be toilet paper or flushable items. I know in some ways this can sound humorous, let's just admit that, but it's actually quite serious because the last thing we need right now is us being all over the city trying to fix clogged up or bursted sewer lines. So the Water Authority is actually taking this very seriously, and so we want to remind folks that I know because of the shortage of toilet paper and so forth, people are using alternative products. Do not flush them. Throw them away. And having just gotten out of the diaper phase with my kids and such, just put it in a plastic bag and bag it up. That's what you got to do. And so try and help out our Water Authority with that right now especially. Okay, some updates from the city as well at this time, specifically with respect to children. I want to remind everyone that our child development programs are still operating, and we're encouraging anyone who can keep their kids at home to keep your kids at home. I know ours have been in our home as well, and we want to emphasize what these child development centers are for right now. They are a safety net for folks who have no other choice, be it because of your income situation or possibly single parent, you have to work. We understand that. We are the safety net to be there for you with these child development centers. Also, of course, for our first responders, for our healthcare workers, and even other city workers. Right now, even janitorial staff and so forth are deemed essential, and so if they need childcare, that's what this is for. Relatedly, programs for children are still being run at our community centers from 7:30 to 5:30 at all our community centers except for a couple which we're now using as some extra capacity for some other activities with respect to our homeless shelter. So we're going to go into this in more detail. These programs are limited. And again, we're asking people do not use them unless you absolutely have to. And again, we understand that a lot of folks have to right now, and that's why we're keeping these open. It's part of the city stepping up to be there for those who are on the front line. So these programs, again, are limited. You have to register through the Rec Track program online. And also our community center day programs are going to be operating based on an additional week basis starting March 23rd through April 3rd. And very shortly we'll hear some more information on that. So I just want to remind everyone why we're doing this. We're doing this in solidarity with those who have to work and have no alternative for their kids at this point. Otherwise, please keep your children at home. So for us, let's talk about some of the specifics. We're going to begin with our Director of Family and Community Services. She is someone who, her department is on the front line for pretty much everything in the city right now. And we're fortunate to have her in this role. Carol Pierce, I think once upon a time was also a registered nurse.
I am a registered nurse.
So also helpful too.
Yeah.
Carol, tell us some more about this.
Great.
Thank you, Mayor. Family and Community Services Department is really glad to be public servants on the front line. So within our department, we are serving as that core safety net, as the mayor mentioned. Let me talk about our child development centers. So across our community, we have 25 child development centers serving children from age 0 to 5. These are all licensed child development centers, and those staff in that capacity are really serving on the front line. Last week, we began with, actually this past week, we began with UNM to let UNMH employees know, those folks on the front line, that we can work to take good care of their children while they are serving as nurses, as physicians, as frontline health workers. And we're working with them to provide that safety net for those families that really need that care. In our preschool program, we typically charge a nominal fee. We have waived that for the last week. So whether those children are coming in for care or not, we are not charging those families. We are keeping the enrollment to 10 or less in those child development centers, and as we move forward, we're looking at maybe consolidating some of our operations. We have required ratios that we maintain, and we're keeping a small amount of children in those classrooms. We have been maintaining the required cleaning protocol for the last 2 weeks. We do the cleaning, the wiping every 2 hours. If children are one side of the classroom, we are cleaning the other side, and then we're switching them. We're just really delighted that we can perform this safety net for all of our residents out there, but we want to really emphasize this is a safety net. This is for those families that really need it so they can actually go to work. So with that, I'd like to hand it over to our Deputy Director, Jess Martinez, who will speak about our work in our community centers.
Thank you, Carol. Currently, right now, we do have 20 of our 22 community centers open for the public. We have a limit of 45 at each facility. We have been open since last week in regards to when APS let out. All we have to do is do an online registration. Everything is on the CABQ website for any information you need to do that. Again, we're here as a safety net. We understand families need that support, and we're here and willing to provide that information.
Jess, how long have you been at the city?
25 years.
Awesome. So Jess is our Deputy Director over for community centers, and we're just so grateful also to have 25 years of experience through this. I believe our team, our city team, and our leadership team, we're in a very good place and have the right set of experiences for these times. And both of these two individuals are good examples of that. Now, ways to help. I want to mention, again, we're highlighting each day a particular way to help. There are lots of ways to help. You can check on all the different material, both on the city website as well as our Joint Information Center for different ways to help. Today, we want to highlight the following. We have 4 health and social service centers around the city. And these centers are also run by the same department, but they are set up to, and they always have been, really help those in need on a specific one-on-one basis. So it's situations where, hey, I need hygiene products, or I need food, or I need help with rental assistance, or other kinds of activities like that. Again, this is more of a case management model, so it just depends on what the person needs. We are keeping these centers open, and they could use your donations. And so we are asking folks if they're interested. They will help distribute funds to people who cannot pay their rent. And they have a criteria and a way to do this and so forth. So they'll run the traps on that. But you can help donate and support that rental assistance program. And you can do that in the following way. Checks can be made out or payable to FCS, Health and Social Services, and they can be mailed to the following locations. We're going to post this on our social media platforms, as well as send out a release for those in the media. So you have these details. So I'm not going to read every address, but let me mention a few. There is the Alamosa Health and Social Services Center. That's on Gonzales Road, and that's, again, one area folks can look, either call 311 if you have questions, or look on the internet for the details with respect to either where to go or where to donate. But regionally, just so you know, there's Alamosa, that's in the southwest. There's Los Griegos, that's sort of in the valley area. It's on Candelaria. There's also John Marshall, that is in the southeast, that's in South Broadway neighborhood. And then there's East Central, that is up in the International District. So again, you can donate to those locations for rental assistance. That would be very helpful. We're going to post all that information. And also, if you are in need, there's phone numbers to call those as well. And so this is another program that we're putting in place to try and support folks in their time of need. Last section we did want to mention today is a little bit about talking to your kids about Corona. We're going to have, I think, some more videos on this. I know the First Lady has done an amazing job coaching me and our kids on this. But to paraphrase a little bit, there's some tips that we want to mention. One is to definitely try and talk to your children about this. What I think we're finding all across the country is children actually seem to get this because they understand germs and things like this. So in general, I think folks, if you've had apprehension, have some faith. Your kids actually tend to pick up on this much more than I think adults thought they would. Reassure your child first and foremost that they are safe. And also, it's okay to feel upset. It's okay to have questions. But number one, that they're safe. And I would also emphasize the temporary nature of this. Now, we know this could be weeks and months. So, temporary, basically just, we're trying to say things like, hopefully, next year at this time, that kind of expectation setting, so that they have a sense that, this is something that's going to be different for a while, but not different forever. That's often a helpful distinction for their own personal anxiety. Of course, try and limit your family's exposure to coverage of the pandemic. And also be careful with social media. If you have older kids, some of the myths that are out there, just make sure you have a good conversation with them about that. Also, while schools and libraries are closed, it's a lot of family time together for us too. A lot of walks, a lot of bike riding. We're really investing heavily in board game time also, and trying to teach my kids how to play chess, which has been really fun. But there's also a lot of activities both now on APS's website, for those of you in central New Mexico, and Albuquerque Library. And so stay tuned for more on these, but there's different things you can do through those programs. Also, try and stay connected with your family members and friends via telephone or video if you can, if you have that technology. That's something I know has been very helpful. We try and do a daily check-in with our parents. And also we have a lot of cousins and in-laws and so forth in town as well. And that's important for them as well. But again, it helps reassure the kids that that extended family community and friend community is still there, and they'll see them at some point in the future. Now, I think the last thing I'd mention too is, of course, just be vigilant about washing hands and so forth, and changing songs or whatever routine you want to do. I know for Jack is 4, and he just refers to this as the bug. That's what he always says, which is kind of interesting. But he'll say, "Daddy, is this because of the bug? Are we doing this because of the bug?" So even he actually kind of understands this and is learning about it, even though we're not using words like coronavirus quite yet for young Jack. So with that, let me share our myth of the day, and then we're going to take questions. Our myth of the day is there's been a lot of challenges, I think, around our entire country's discussion with respect to vocabulary. And I'm not the best at vocabulary either, but I do just want to highlight one important thing. We're using a term called social distancing, and I think that right now is sort of an accepted term. But I want to just be clear what that is not. It really is physical distancing. That's probably what we should be calling it. It's about keeping apart from each other. We want to make sure people are socially connected, even though they're physically distanced. And so that could be literally waving at people on the street. It could be, of course, using the phone, using the internet, trying to stay connected now more than ever, actually, but also maintaining that physical distance. So that's just a little bit around that term. And lastly, we always wrap up with takeout this morning was Burke Bakehouse. Thanks so much. It was excellent. All right, so questions. Yes.
When it comes to those childcare centers, can you talk a little bit about how you're protecting those childcare workers and what you're doing to make sure that they're safe as well?
Great.
And repeat the question.
Okay. The question was, in terms of our city's child development centers, how are we keeping our workers safe? So first of all, we are following across the city. If anybody were to have symptoms or had chronic conditions, we are encouraging them not to be at work. And so we have gone through a process with all of our workers to follow that process. We are encouraging anybody who has any symptoms not to be at work. So as with all of our practices, we are encouraging the frequent hand washing, the keeping people well supplied or child development centers to keep all the facilities safe. We had an excellent citywide call the beginning of the week on Monday with all of our child development workers to do some problem solving. So for example, typically a family would come in a child development center, hold a pen, sign their children in. We are not sharing pens. We are asking people to stay outside the door, and we've put signs. So that's one example of adaptation during this time. I do want to say that our division manager, Shauna Runnick, who is really talented and with us, she is on a call every day at 8 a.m. with the Secretary of Child Development with the state, connecting throughout the state and learning about some other practices that we may do.
Yes.
With those families at home, and we've heard from a lot of people about those resources running short, like formula, toilet paper. When you've got kids at home, are there any resources for people anywhere that people can go if they're running low on those supplies?
So the first thing they should do is probably check in with 311, and 311 can direct them to sort of on a given day what resources are available. We also are announcing new resources, like this morning we're going to start trying to do more home deliveries in partnership with a lot of faith-based organizations. So I would kind of stay tuned on that in the short term. And this morning we are working with a number of churches and our delivery mechanisms to actually try and help with exactly that. So these would be sort of supply box deliveries. But I also want to just manage expectations. We're just now starting that. So we're trying to work through that as we can. In the very short term, I would call 311, and then these health and science centers, health and social service centers would be the next place to call. Or if you absolutely just need to go somewhere to talk to someone, that's where I would go. And again, there's 4 of those that we're going to post today. Any other questions here? I think so far sort of online and on the phone, I think we're actually wrapped up there. Any others for the folks who are appropriately physically distanced from me at this time? All right, I think we're good for now. And again, those of you online, we're going to have our Community Direct Forum on Facebook. We'll do another one on a different platform in a few days. Thanks so much, Albuquerque.
Those are good ones. Chess and everything.
We got
board
more,
games.
man.
Yeah.
It's cabin fever.
Yeah. No, I have a good supply of board games. We were kind of messing with